Hello and welcome to this microeducation video on documentation. My name is Dr. Ju-Young Chun. I'm a consultant interventional radiologist at St. George's Hospital in London, and I'm also a member of the Clinical Services in IR Task Force. So a reminder that we are interventional radiology clinicians. IR is a clinical specialty, and as responsible IR clinicians, we have the technical skills to be able to perform procedures effectively and safely, and the clinical skills to be able to offer our patients continuity of care. So where does documentation fit in IR clinical practice? As you can see, it's important to document each of our clinical encounters so that it's visible to all clinicians. And copies of all clinic letters should be sent to the referrer, family physician, and the patients. This is so that there is a record of all of our clinical activity so we can be remunerated for time spent doing so. Most institutions will have moved from paper records to electronic records, but whichever type you have in your institution, it's important that each interaction with IR services is visible as clinical encounters in the patient's medical notes. And this includes outpatient clinic letters, procedure reports, ward round records of inpatient review, follow-up clinic letters, as well as discharge summaries. It's also important to be able to prescribe medications as well as record which ones have been given. This is an example of a clinic letter. A patient has been referred to me by the consultant gynecologist here as the referring clinicians. Just as an outline for your letter, so this is headed paper. It says Department of Interventional Radiology. We have a list of all of my IR colleagues, telephone number and email so that whoever receives a copy of this letter knows how to contact us. The opening line talks about how old the patient is, how many children she has, and what her occupation is. And then we delve into the symptomatic history of her fibroids, relevant past medical history, what the imaging shows, whether I think she would be suitable for UAE, and any other imaging findings that need follow-up. Then we discuss what the patients and I talked about with regards to the procedure itself in terms of the arterial access, about what's expected in terms of post-embolization syndrome, and that we would admit her to give her some morphine PCA post-procedure. Sign the letter off. Everyone knows who I am, and a copy goes to the family physician and the patient so that everyone's on the same page. This is the inpatient medical records. So here's an interventional radiology procedure, uterine artery embolization. So this is a procedure note by interventional radiology. The procedure is uterine artery embolization. All of my procedure notes are divided into sections, so indication, who the operators were, medications given during the procedure, arterial access, angiographic findings, the treatment that we've given the patient, followed by the plan for post-procedural care. Then this is a record of patient review the following day on the ward. We talk about various things like pain control, the puncture site, but importantly, what we would like the plan to be for the rest of the day. And again, sign it off. Now, this is an outpatient letter. This is a follow-up clinic of a different patient. Again, department, people, contact details. This letter is addressed to the family physician. And this patient is a gentleman who was admitted with acute on chronic mesenteric ischemia, who'd lost 4 stones in weight and had commenced TPN when I met him. He needed to have recanalization of an occluded SMA, And this particular paragraph talks about his slightly stormy post-procedural course, but then he recovered, now has excellent appetite, put on some weight, and I'm happy with his clinical outcome. We talk about any drugs that he needs to continue, and then I'm going to discharge him because I'm happy with his clinical course. But I state clearly that if symptoms recur in the future, to contact me directly so that any clinical delay is avoided. I sign it off, copy goes to the patient and to the referring clinicians, who was the vascular surgeon. This is to show how you can make your life a bit easier by setting things up with working together with the IT team that delivers the electronic patient records. So we have different types of documentation that fall under the interventional radiologist. So some of them are for doctors to use, some of them are for nurses to use, and for different sort of clinical encounters. And then this is to demonstrate how you can, again, make your life a lot easier by creating a list of commonly used medications in the IR suite, and so that you can just tick them off as you need, and it speeds things up a little bit. So, for example, generic drugs that we use in a lot of cases: oxygen, lidocaine, sedation. Any medications to do with diabetic patients, commonly used medications for prostate artery embolization. We've got a list of radial cocktail here, scleromeds, and medicines that we use for uterine artery embolization. So shortcuts to make your life easier. In summary, it's important to document each clinical encounter using the same platform and in the same way as all other clinical teams. Inpatient, outpatient encounters visible to everyone who is also looking after the patient. And outpatient clinic letters should have copies sent to the referrer, the patient, and the family physician, so everyone is in the loop. And important to be able to prescribe medications and record when they were given in the same way as all other clinical teams do. And all of this clinical activity is then visible to everybody, and so that then we can build on the clinical activity and the clinical practice that we already have, and we'll be remunerated for our time so that we can have more dedicated time, more dedicated people, and more dedicated space to expand our clinical services. If you'd like to do some further reading, I would point you towards the clinical services section of the CERSI website. And two things in particular: the CERSI library topic package on clinical practice building in IR, and the CERSI Academy course, clinical practice in IR. Well, thank you for listening. I hope this has been helpful in helping with documentation in your IR practice, and I hope to see you all soon. Thank you.